And welcome back to part 2. We're talking about autoimmune diseases. What I'm going to do here in this section is I'm going to ask a few questions and then you're going to try to answer them. So first, let's talk about lupus, systemic lupus erythematosus. Can you tell me what type of hypersensitivity reaction this is, and what does this involve? What is it that causes the problems? So remember, this is a type 3 reaction, type 3 hypersensitivity, and this involves immune complexes. So can you tell me some more details about lupus? First, tell me about the autoantibodies. What do they react against? The autoantibodies react against DNA, blood cells, neurons, and other tissues. Remember that when the cells die, the immune complexes form and deposit under skin, joints, in kidneys, blood vessels, and the central nervous system. And this interferes with the normal function of these sites, so we may expect arthritis, rash, kidney damage. This is all as a result of inflammation. And remember that most patients are going to die from kidney damage. And one of the most talked about autoimmune diseases is, of course, lupus. And so can you tell me what are some examples of where you would see lupus attacking the body? What problems might you see? Well, first, of course, we would have the typical butterfly rash, and there are different types of rashes that we will discuss. But we could have pleural effusions, heart problems, lupus nephritis, and Raynaud's phenomenon. We'll talk about what that is. And remember that the lupus symptoms vary widely in each person that is affected. So if you remember from an earlier video, we were talking about the importance of estrogen and testosterone, and that in females where they have a high level of estrogen, there may be a high propensity to have autoimmune reactions. And so remember here in this case in lupus that estrogen is a stimulator of B cell activity. And remember that lupus is more prevalent in females, especially between the ages of 15 to 45, which is the childbearing years, and this is the height of the estrogen production. So what interleukin is involved now? And remember, this interleukin is a B cell stimulator, and that it is high in lupus patients. This is interleukin 10. So remember that this high concentration is linked to cell damage and is caused by inflammation. So let's remember the main pathology here that is in action. Remember that the plasma cells are producing antibodies that are specific for self-proteins. And remember what these self-proteins are. What are they looking for? They are targeting the double-stranded DNA. So we have overproductive B cells. So we have overproductive B cells, and what is it that is suppressed oppositely? We would have suppressed regulatory function in T cells. So the T regulators would be suppressed. So we have a lack of T cells, and we have an activation of the complement system. So as a very simple summary, just remember high B's and low T's. And the main pathology here is we're having overactive B cells, and they are attacking cell proteins and specifically the double-stranded DNA. So can you name some of the symptoms of lupus? Although they are non-specific and they vary depending on the person, we have fatigue, weight loss, malaise, generally feeling ill, fever, anorexia over time, and arthritis may be seen. In fact, they say that 90% of patients experience arthritic symptoms, and this would be symmetrical, meaning that you would have it in the hands and the wrists and the knees. So remember, fatigue, fever, weight loss, and symmetrical arthritis is some of the main symptoms of lupus. So just to repeat, fatigue is very, very common in patients with lupus, and although you may be treating them with immunosuppressants, you're going to find that fatigue is the one symptom that is going to remain during flare-ups and after. So what are we seeing mainly here? We see often a low-grade fever. We can see anemia, and remember, this results in fatigue. So sleepy, hot, anemia, and inflammation.